So we have a patient who's asking what the chances are of focal treatments being covered by Medicare in 2022.
Well, some focal treatments are already covered. If people have focal radiation, for example, the radiation therapy is covered by Medicare. They're probably referring to things like focal HIFU, focal laser treatments, and I'm not aware of anything in the offing for Medicare coverage. It's not really my expertise. Billing questions are dealt with by other people. But types of treatments that are already covered, things like possibly cryotherapy, I think, can be covered by Medicare. Not sure of that. Certainly radiation. And people don't think of using radiation as focal therapy, but it really works quite well. There is a need to be dealing with a radiation therapist who's willing to work outside his normal comfort zone. And all focal therapy presents a lot of challenges to get it right. You have to make sure there's no cancer in some other part of the prostate, and then the doctor has to design a field that allows for the uncertainty as to where the tumor ends and the prostate begins. So you have to put a radius around the tumor to make sure that you're really getting it all. And then, of course, you don't want to go too far and then create other side effects by unnecessary treatment. But most of the focal treatment that we are doing now is with different forms of radiation, and that is covered.
If the prostate volume is over 70 cc's, is it a contraindication for doing SBRT?
So as the prostate gets bigger, if you want to radiate the whole prostate, which is the standard approach, there's going to be a larger dose of radiation delivered to that larger volume, and side effects start to go up. There is upper threshold of what can be safely accomplished with beam radiation. And is it in the range of 70 cc's? It's probably a little higher than that. It's also dependent on the anatomy for each individual. There is something called simulation, where they line up all the beams before they start the radiation, and they can see how much are the surrounding structures going to be touched by the different angles of the beam and whatnot. So the variables that need to be taken into account when people embark upon radiation are, yes, how big the prostate is, what's the anatomy look like, and are there pre-existing symptoms? If people have a lot of pre-existing urinary symptoms that are already troublesome, adding radiation on top of that can create a problem. So there's various factors that need to be considered before someone can say it's a reasonable approach to do radiation treatment. As the prostate gets bigger, the opportunity may be presented to do focal treatment rather than treating the whole gland. People that have very small glands don't gain that much by doing focal treatment, because you have to put a margin around the tumor, and you may end up encompassing the whole prostate anyway, even though you're attempting to do focal therapy. People that have big prostates can put a margin around the tumor site and spare a lot of the prostate, and reduce side effects and reduce the risks for problems like erectile dysfunction. So if people are open to the idea of doing focal therapy, and if they're candidates, that is, if they have an isolated spot, then perhaps they should talk to their doctors about doing some sort of focal treatment rather than treating the whole gland.
Hey everybody, it's me, Alex, and our mascot here, Hunter. He's obviously licking my hands because we have lots of treats for him today. But yeah, we just wanted to let you know to go ahead and subscribe to our YouTube channel. We come out with new prostate cancer videos every week. And go ahead and check him out on Instagram at Sir Hunter the Dow. Also, check out our website, PCRI.org, for more information about prostate cancer. We hope it helps.